In this video, we provide an overview of the main results of the COVID study conducted in primary care. In this study, we describe the nutritional status, risk of sarcopenia, and nutrition-related complaints of patients recovering from COVID-19 who were treated by a dietitian in primary care in the Netherlands. The study was conducted by Amsterdam University Medical Center and Wageningen University. On this slide, you can see the names of the research team. In addition, there were a lot of primary care dietitians who participated in the study. We would like to thank all dietitians who collected data for their contribution to the study. The COVOED study is a retrospective descriptive study. Patients recovering from a COVID-19 infection who received dietetic care by a primary care dietitian in 2020 could participate. The inclusion period was from April to December 2020. Data were collected on nutrition-related complaints, nutritional status, and dietetic treatment. The nutrition-related complaints depicted here were included. Nutritional status was defined with recent weight loss and BMI, and there was a risk of sarcopenia with a score of 4 or more points on the SARC-F questionnaire. From dietetic treatment, we collected data including the referring physician, number of consultations, and the reason for ending dietetic treatment. In total, 246 patients were included in the study. 61% of the patients was female, and the mean age was 57 years old, with a standard deviation of 16 years. 43% of the patients were hospitalized for COVID-19, and half of them were admitted to the ICU. This means that the majority of the patients were not hospitalized and experienced the infection at home. Hospitalized patients were older, and the group of hospitalized patients consisted of more men. The comprehensive results can be read in the scientific article. In the next slides, we will present the main findings. First, the nutrition-related complaints. Almost all patients reported one or more nutrition-related complaints. Decreased appetite, shortness of breath, changed taste, loss of taste, feeling of being full were the most common. This figure shows the percentages of complaints reported by the patients. More than half of the patients experienced a decreased appetite. Looking at the course of the nutrition-related complaints, we saw that they improved slightly after the first consultation with the dietitian. But despite this improvement, symptoms persisted for months. After 4 to 6 months, the most commonly reported nutrition-related complaints were changed taste, loss of taste, and shortness of breath. Mean BMI of the first consultations was 28, and 67% of the patients were overweight or obese. The majority of patients had experienced unintended weight loss compared to their usual weight. However, over a third of the patients regained weight in a month before the first consultation with the dietitian. 24% of the patients hospitalized for COVID-19 had experienced 5 to 10% weight loss. For patients who were not hospitalized and thus experienced the infection at home, this was 12%. Unfortunately, data on fat-free mass is missing, so we cannot say anything about the increase or decrease in fat-free mass. Of the total group, 44% of patients had an increased risk of sarcopenia. Patients who had been hospitalized for COVID-19 were more likely to have an increased risk of sarcopenia. Most patients were referred to the dietitian by their general practitioner. The median number of consultations was 5. More than a third of the patients had 6 to 8 consultations with the dietitian, and 31% of patients had 4 to 5 consultations. Oral nutrition supplements were prescribed in almost half of the cases, and the physiotherapist was involved in the treatment of the patients. 80% of the patients were also treated by a physiotherapist. The treatment goals were achieved in 75% of the patients at the end of the dietetic treatment. The study did not record the main reason for referral to the dietitian. Currently, a large prospective study is being performed in which patients are followed over 1 year. Within that study, the reason for referral is collected. The main recommendation that follows from the results is that the frequent occurrence of nutrition-related complaints makes it necessary to treat these complaints multidisciplinary and pay attention to these complaints, weight loss, and risk of sarcopenia. Another important finding is that the risk of sarcopenia is a common problem in COVID-19 patients. The measurement of body composition is necessary to identify and evaluate this. The physiotherapist can be an important partner in getting more referrals. A large proportion of patients is also treated by a physiotherapist. A multidisciplinary approach can enhance patients' recovery. The results and recommendations are also elaborated in this infographic. The comprehensive results can be read in the scientific article.